Hello, 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 hello. Good evening to all of us here. Uh, so far, I think we have zero attendance. So I think we have to. Okay, one person has come, waiting for some few people to join before we start today's lesson. Today we are treating bird flu, also known as avian influenza. So if you've joined, kindly share for other people to also join. So if you've shared, you can even share more. So tell other colleagues that Time with Dr. Cheme is live on YouTube and Facebook so that they can also join and have the lesson with us today. Okay, Doc. I think we have about 7 people, so we can start. But uh, today we are doing bird flu, but in as much as we are doing the bird flu, this particular program is being sponsored by two companies, and one is Jokovet, the other is Impuntu Farms. Yes, and I have this particular product here that I would want to recommend to all layer farmers. I would want to recommend this. It's from Jokovet. They are the main importers for this particular product. It is called Golden Multivitamin. It is made up of vitamins and amino acids. Yes. And this product, if you're a layer farmer and you've not really used this product before, then you have to have a serious try with this product and you will never regret. And so those who are online or those who will watch later, you can contact us, you can contact me personally. Yes, for this particular product. Yes. And if you have laying birds and you give this product to them, they will lay very well. And it also help to give the yolk its natural color, the yellow color. If you are having issues with soft shells, this will eradicate soft shells. Okay, it has a lot of vitamin D3, and this will be very appropriate for broilers as well, especially broilers that have weak bones and all that is affecting their knee and all that. So this particular product I recommend because I've used it personally and I've also given it to other farmers that are using it and the kind of testimony. that are coming out. It will blow your mind. Okay, so golden multivitamin is your go-to in terms of vitamins. So when they are laying, don't just give them anything. Give them this, and you will never regret doing so. Okay, so today we are looking at bird flu. I think every farmer, most of us have heard bird flu. In fact, around 2019, there was a serious issue on that. And in fact, there was a ban placed on Holland bears, Holland of all people. We were not importing bears from Holland because they said bird flu was in Holland. So Ghana had placed a ban. So if a disease can cause a whole country to be banned from exporting their day old chicks, then it's not a small disease. So today, doctor is here to break down and give us some understanding on the avian influenza. So without wasting my time, Doc, good evening.
Yeah, good evening, Dacosta. I hope you're well.
Oh, I'm fine. Your side?
Yeah, I'm good too. I'm good too.
Okay, okay. So, Doc, you brought up this topic, bird flu, and
Yeah.
today, me, I've heard a lot about bird flu. I don't know those who are also watching us. I don't know how much they know about this disease. This disease, there. When you hear of bird flu, then it means total collapse. So since you are here, I won't take words from your mouth. I'll just give you the time, and after that we'll come in with our questions, and we'll give today's program a close. So I think yes. So this is the slide. So Doc, you can take
All right.
over.
Thank you very much. So you're all welcome to another session of Time with Dr. Boache. So today will be our last session on our viral diseases. Before we spoken about Gumboro, Newcastle, Firefox, today we'll be dealing with avian influenza, commonly known as bird flu. That's how most of us know the name. And just as we always do, we are going to go through the disease, looking at what the disease is, how the disease is transmitted, how do we identify the disease, how do we treat and then control, the ways we can prevent the infection from getting to our farm, and then some few general recommendations that can help us in our bid to fight and then ward off this infection. So, avian influenza, this is a viral infection. Just as we started our treatment or our discussions, we are doing viral infections for now. And this is the last one for this session. This viral infection usually affects poultry bears. However, wild bears are usually carriers of this infection. Carriers usually mean that they have the infection or the pathogens in them, but they don't show signs of illness. So, in simple terms, no, nneɛma na ɛkɔ so yareɛ no wɔ mu. However, ɔmo deɛ ɛntaa mbɔ ɔmo yareɛ. Okay, so if your farm is open to wild bears coming in, there is a high possibility say they can introduce the virus onto your farm because omo de embo omo yare, but omo koba omo ba ni nyinaa no, once they share it in their stools, they can present it onto your farm. So you should be careful about that. And this infection, the severity of the infection or the pathogens, a sort divides it or gives out its name. So we have two main types. You have the highly pathogenic and then the low pathogenic avian influenza. Okay. And then from even their name, it tells us how the virus works. So the highly pathogenic means the severity of that infection is usually very high. And then the one with the low pathogenic, the infection associated with that one is very low. So usually with the high pathogenic, you get a lot of mortalities, sudden death. You won't say "Ura farm honoma," you didn't see any signs of illness, and then all of a sudden, a lot of the birds are dead. But usually in the low pathogenic, you have mild infections like that. Yeah. So with the highly pathogenic, you'll be seeing, just as I mentioned, the sudden death, loss of appetite, respiratory issues. So they'll be coughing, they'll be sneezing, almost like signs of CRD. And then in laying birds, you have a drop in egg production. As I stated earlier, wild birds are usually the carriers. So they just carry the virus or the pathogens around, shedding it in the environment, but usually they don't fall ill from having it. However, the zoonotic component of this infection is very low or very rare. It is not usually common. Say the infection is usually spread from the animals to human beings. Okay. However, there's an influenza virus or the common flu. It affects human beings. I know yeah, a form of this same virus. Okay. So this virus, no, there are two components, H and then N. So but you know, you see H1N1 about H5N5. These are some of the strains of the virus, you know. Okay. And then that's what causes the usual common flu in human beings and then swine flu in pigs. But you seldom get zoonotic infections, say the disease being transmitted from animals to human beings. However, the few cases now it has been transmitted from animals to human beings. You know, you see conjunctivitis, so both in the near arsenal under the eyelids, you know, there's an inflammation going there. And then in severe cases, you know, you get respiratory infections. Now, how is this disease spread? Two main ways, direct and then indirect. So with the direct, you know, the pathogen enters the body of the animal through the oral fecal, through the nostrils. Once the animal has a direct contact with the virus, you know, that's how it can spread. And we a direct contact. And then indirect, you know, sabuano home, na say droplets no around, and then other animals also pick it up. That's indirect. But direct here, when the animal itself picks up the pathogen from the environment. And then we've also discussed fomites. So fomites, no, yeah, any surface on the farmer that can be contaminated with pathogens. Any inanimate object on the farm, okay, that can carry pathogens, you know, it becomes a breeding ground for these viruses and then pathogens. Now, once the animal goes and then picks it up, you know, infection can occur. As I said, there are two main forms of this way disease or infection. We have the highly pathogenic and then the low pathogenic. So we are going to discuss briefly about how we can identify the low pathogenic avian influenza. So with regards to the low pathogenic avian influenza, now we are discussing how to identify, that was the next slide, how to identify the low pathogenic avian influenza. Yes. So usually the common signs are we notice are sneezing, they will be coughing, there will be ocular or nasal discharges, swollen infraorbital sinuses. So with the sneezing, we all know how the animal sneeze. You'll be hearing that quack, quack, quack. Usually in the night, no more than you'll be hearing that sound. Coughing to most of us have seen how the animals exhibit this sign. Ocular and the nasal discharge, won't say you have fluids coming out from under the eyes, from the eyes, and then through the nostrils. Okay, there'll be discharges from the eyes and then the nostrils. In severe cases, there might even be blood in it. The fluid coming out from the eyes and then the nostrils. And then swelling for orbital sinuses. We say the near sin almost not ahono. just under the eyes, no, there will be some form of edema or swelling over there. Okay. And then there's usually congestion in the trachea and lungs. I know, yeah, you might not see that, but yeah, say we the doctors, what the PM banner say, yeah, postmortem. When you open the carcass, now these are some of the things we see that helps us to identify, say, ABR, is this infection or not? So there will be congestion and the inflammation in the trachea and the lungs. Okay. And then in layers, no, you get severe drop in egg production. And then in breeders, no, TBR, breeding stock, no, where you get your birds from, no, you'll realize that they are not able to hatch a lot of eggs. There'll be high infertility. Okay. So these are some of the signs that we can use to identify the low pathogenic. You'll be seeing the signs of the CRD like sneezing, coughing, ocular and nasal discharges. Under the eye area will be swollen. And then in layer bears, you get a severe drop in egg production. And then in the breeding stock, there's a high possibility of infertility. Now to the high pathogenic avian influenza. As I stated earlier, sudden death. You don't see any signs. All of a sudden, you go to your farm and then 10% of the birds are dead. 20% of the birds are dead. Sudden death. Okay. The farmer will go in and then be like, oh, and now I'm calling that birds from now you're okay, they were all active. Then all of a sudden, my birds are dead. The next one is cyanosis and then edema of the head, comb, and wattles. This particular topic, is a bit technical. I've tried to remove a lot of things, but some of the big words, but I'll explain it all to you. Cyanosis and then edema of the head, comb, and the wattles. Cyanosis will usually give you a blue discoloration. To be honest, the tree color, no, the comb, no, the wattles, no, it has changed color, looking a bit bluish. That's the meaning of cyanosis. And then edema is basically swelling. Okay, to be honest, you realize that you go to your farm, most of your birds are dead, and then the few ones that are active too, their combs, wattles, the head is looking a bit bluish. And then there's some form of swelling on the head. The next one is the same edema again, and then red discoloration of the shanks, feet, due to subcutaneous ecchymotic hemorrhages. Both and the nine no isisi honum no. A thought that bones a moja ejinemu. Okay. A thought that color better than the blue. A thought that bones the nine is also usually it should give you some pale yellow color. Be the shanks is on the nine. Your friend shanks. The color is usually pale yellow, golden color. Be. But when there is avian influenza infection, you realize that the foot will be a bit swollen, and then echinotic hemorrhages. I know you're basically blood, moja agent and nine kakra. Okay. And then say yeah, postmortem, yeah, we realize that there are a lot of particular hemorrhages on the organs. Particular hemorrhages say moja CC on dot. Internal organs. So you see pinpoint hemorrhages. Once you open the carcass, you see pinpoint hemorrhages across almost all the organs. And then there is blood tinged oral and the nasal discharges. Just as I stated in the low pathogenic, realize that there are discharges from the eyes and then the nostrils, and then in severe cases, it will be a bit bloody. In severely infected birds, you can have the greenish diarrhea. And you've noticed that you get that in Newcastle sometimes too. So it is quite easy for you to confuse the two infections, because you realize that in Newcastle too, you saw some of these respiratory signs in there, and then we are seeing them over here too. So the main way you can use to differentiate between the two is in this one, you get a lot of petechial hemorrhages, sorry, blood hemorrhages inside the organs, inside the shanks, both moja jina and nine AC honum, and then there'll be swelling in the infraorbital sinuses, the combs and wattles. Are there red nacy or mutrino? Both say as a aswana ahono. Okay. And then one thing you can also use to identify this infection is that once you when there are mortalities and you open the carcass, the ties no hono, bones and moja eta honum. So one of the signs we use at the lab is say after we've seen some of these things, will be a ties ni muna, then you get blood in there. However, usually we do test at the lab to confirm this infection. And then those who are able to survive, after some time, they develop nervous signs. Okay, they develop nervous signs like torticollis, and we saw this in Newcastle also. There, at one bed, the corner, the tear shed at the head is twisted, no, the neck is twisted. Then we try to host just like in Newcastle. They just twist their neck like that. In coordination, or cool or about it's just moving anyhow. It's not coordinated. The movement of the animal is not coordinated. And then paralysis, you can get paralysis too. Realize there's nothing wrong with the bird, but they are unable to stand and then walk. Okay. So how to identify this disease? We've talked about the low pathogenic and then the high pathogenic. With the low pathogenic, we said you see signs of the CRD, there'll be sneezing, coughing, ocular discharges, nasal discharges. The face will be a bit swollen. And then in laying birds, you can get a severe drop in egg production. Okay. And then with regards to the high pathogenic avian influenza, sudden death. The animals are dead, and all of a sudden, you enter the pen, 10, 20%, 30% of the birds are dead. You get cyanosis, bluish discoloration of the combs and wattles. Color no than blue. The feet to the same thing. Realize that as I done blue, moja jinemu. Baby abuanum, you realize that a lot of blood hemorrhages, petechial hemorrhages inside the organs. Both and akuma no, I said moja is dot. Liver no, ebisi ho, intestines no, ebisi ho. And then in severe cases, there is greenish diarrhea, just like in Newcastle, now we discussed previously. So with the image you see over here, the first picture is a bird that has the edema and then the swelling on the face. To share the wattles now, and then you look at the comb too, it's a bit bluish. The near so there's a swelling infraorbital sinuses, they are all swollen. And then on the picture on the right side of the first one, realize that the picture on top is a bit reddish in there compared to the one beneath it. So the one beneath it is the normal one, but the one on top, the color is a bit reddish because moja ejina ne nine two BM se moja on a nine. The one beneath the first image, is an animal that's looking down, depressed, showing signs of weakness. Okay. And then if you look at the two bottom images now, the one on the left is the heart. Their blood pinpoint petechial hemorrhages on the heart. To baby as a fat kakra nakuma no na moja nesisi honum sano. And then the one on the left, the one on the right is the follicles, and then you can see blood in there, pinpoint hemorrhages over there. Okay, so these are some of the signs now we can use to identify this infection. However, we've discussed this time and time again, say you can't treat this infection. Mr. Da Costa, next slide. you can't treat viruses. The best you can do is to provide supportive care and then give antibiotics for secondary bacterial infection. This is because once the virus comes into the animal, it brings down the immune system of the affected animal. So once the immune system of the animal has gone down, other pathogens that were environment in manka under normal circumstances, it shouldn't cause infection in the animal, will take over. And then this will lead to the animal coming down with secondary bacterial infections. Okay. So please don't let anyone deceive you that, oh, there's this antiviral drug that's good for this antiviral has no help doing, but it doesn't necessarily go into treat the virus. No, they give we give things that will help to treat the virus directly. Okay, so you don't treat viruses. However, you provide supportive care and then you give antimicrobials to help fight against the secondary bacterial infections that may prevent. Not recommended. Some question marks. And if you see your chart, you realize that there's no form of vaccination against avian influenza. Okay, you only do vaccinations against Newcastle, Gumboro, Fowlpox, but there's none against avian influenza. This is because there are a lot of strains of this virus, so it's very difficult to come out with a particular or a singular commercial strain that can take care of all the viruses at the same time. TABR said, if you should get the infection on your farmer, even the farm next to you, the strain of the virus might be different. And then we've noticed that virus is not vaccines now they've developed, it's not able to work across different strains like that. Okay, so that's one of the reasons why there isn't a particular vaccine against the bird flu or Newcastle. However, very huge farms are who have been in the system for long, to me call now test among so that they get the particular strain of the virus on their farm, and then the vaccine companies develop particular vaccines for them. Okay, because the strains are a lot, and it's very difficult to develop one commercial vaccine that can take care of most of the viruses at the same time. So that's one of the reasons why we don't have vaccines for avian influenza in Ghana here. And then, as we've discussed right from the beginning, your biosecurity is your main way to prevent the infection and then control it. This one, it is better for you to not even get the infection at all in the first place. Because in severe cases, once you get the infection, your friend vet near back home now, we realize that it's very severe. You end up killing all your birds, and then some few farms that are in close proximity to your place. Because we stated say the virus even travels through the air. There's an aerosol component that can spread the infection. So in severe cases, once a particular farm is infected infected, most of the surrounding farms around that particular farm, we have to go there, and then we condemn all your birds. It's called stamping out. We won't say Abia, birds, they are not infected though, but VS before buy and all the banning in or share the virus no our environment no. Okay. So try and reduce or restrict access of wild birds onto your farm. To both usual mobile Ramsey site and then river bodies no. There are a lot of birds that are around that usually come in there. These birds are usually carriers. Okay. So we beg you, try and restrict access of some of these birds from your farm. Early detection. When you yari anything, consult your vet, separate affected animals, and then your vet will direct you on how to go about things. However, it's a notifiable disease in vet knew who are, and then once tests are done to confirm, he has to report it to the authorities, and then the position that they will take. Okay, it's very serious. You don't joke with it. You don't joke with it because infection in your bow farm honoma. I'm sorry. Most of your birds will die on their own. The mortality rate is usually very high, especially in
Hello, Doc.
highly passive. Then
Doc.
Jacosta,
As a on network, and shut down so for like 2 3
Jacosta,
minutes. Yeah.
is it okay now?
From biosecurity, a cat,
Is it okay?
yeah, is that okay. So I think Doc will rejoin, but for all those that are looking at this particular product currently, this is golden multivitamin, eh, and the golden multivitamin that you've heard about is for layers, for laying birds. So if you have laying birds, this is the appropriate vitamins to give them, and it will help them lay a lot. It will help them lay a lot. See, all those that are laying today, tomorrow they are not laying. This will boost them up. Okay, so this is golden multivitamin, and let me tell you something small about this particular product. You see, it says is a laying bed booster. It enhances bigger eggs in laying beds with improved yolk color, good shell thickness. So, because of the vitamin D, it actually has about 5 million international units of vitamin D, and yes, more. So, Vitamin D also help in the absorption of calcium. Yes, so if you have this particular product, forming eggs in layers becomes very easy, and they will lay for you. Okay, so we have some at our shop. You can contact us, or you can just walk in and pick one. And it's not expensive to compared to all other vitamins that are on the market. Okay, so I think if Doc has joined us, let me Doc, Doc, if you can hear me, think you can unmute your mic and we will continue. And we have an upcoming beginner training. So this is for beginners. We are starting on the 25th of August, which is next week, Monday. Next week, Monday. So if you know anyone who will be interested in joining this particular beginner training, yes, kindly let him or her contact us, and we will add him or her to the set edition of the beginner training. Okay, so this is it's going on. It's going on. It's going on. What we've been doing on Sundays, these are not beginner friendly. Okay, so if you are a beginner, you want to start your farm, even maybe you've not started with the construction, and we take you through construction, brooding, all other beginner topics. Okay, and we'll teach you how to start your farm. If you want to know the number of birds with regards to, let's say, the amount of money that you need to raise about 1,000 birds, 500 birds, this is the kind of training that you would join. The one as I said, the one we've been doing on Sundays, these are not beginner. If you're a beginner and you are following us, it's good, but this is what the one that we are going to do on the 25th to 29th. That one is beginner friendly. We take our time, we use videos to show you whatever you will need on the farm, and also whatever you need to start. You can start with 150. It doesn't matter. You just start, because when you start, that's where you know whether farming is for you or not. Okay. So that's beginner poultry training, and it's online. Like what we are doing. That's the same way that we do it. And we all join and we share ideas. We show you how to start your farm. Okay, so doctor is in now. I think we'll have to continue. So doc, from biosecurity.
All right. So sorry for the poor connection. I don't know what happened. So we are talking about the prevention and control measures for avian influenza. So please, you can't vaccinate against this infection. So your go-to way of control and then prevention is through biosecurity, to ensure that you restrict access of birds, especially wild birds, coming onto your farm. Okay, and then restrict access of people. Use the proper disinfectant, proper hygiene, and then surveillance are very important in reducing the chances of the infection coming onto your farm. And I was saying that the main control measure is through stamping out or total condemnation. Okay, this one, once the infection is reported to VSD, we have to, once it's reported and then we do tests to confirm that it's actually avian influenza on your farm, you have to do stamping out. And then this is basically killing all your birds because, first of all, there's no vaccine to help control it. And then the strains are a lot. So once it persists, if you allow the birds to persist for long, the virus will continue to develop, mutate more, and then more strains will come up. So the main control measure from, let's say, VSD will be to stamp out your birds. So realize that people say that VSD by number money. Meanwhile, your animals were not showing signs of the infection. Yes, that's true, but probably a farm very close to you had the infection there. And then once we realize the severity of that infection, we might have to stamp out a few farms around just to form a ring and then prevent the infection from spreading out wide. Acosta, next slide, please. So, general recommendations. So, ensure proper disinfection before, during, and then after. As I said, you can't treat this. And then this is one of the most annoying viruses or pathogens that you might have to deal with. So, please ensure that your disinfection, your biosecurity, your hygiene protocols are always on point. Else, once you come down with the infection, you might have to stamp out all your birds. You might have to slaughter, clear your farm of all the birds. Okay. And then the next one is don't bother with commercial vaccines. Okay. As I was trying to explain earlier, there are a lot of strains of this virus. So the strain that might be on your farm might not be the same on another person's farm. But usually what we do is in the very old and then big farms, you can have your animals tested and then they will formulate specific vaccines just for your farm. Uh, Recently, most of the farmers just end up, they hear that, avian influenza is there, but VSD doesn't allow people to vaccinate against it. So they will just import their own vaccines and come. But it doesn't help because the strains that you are getting, the vaccine that you are getting, is formulated for that particular strain from Europe or wherever you are getting the vaccines from. So you might think you are vaccinating your animals, but you are actually not really doing much because the strain we have here is different from what they have in Europe, Asia, and most of the other countries. So please don't even bother. Just ensure that you focus on your biosecurity, and then that will help to reduce the chances of the infection coming on your farm. Proper carcass disposal and litter management. The viruses easily breed and then persist in the environment. So if you are not clearing some of the things that can allow the persistence of the virus in the environment, you are allowing the virus to continue to harbor in your environment. And then later on, once the immune system of the animals goes down, they can easily come down with the infection. Okay. So always treat your litter, dispose them off properly, same as your carcasses also. And then try and buy your birds from trusted sources, just as I always tell you. So, as a form of summary on the recommendations, do your biosecurity and then disinfection properly. Don't bother with vaccination and then proper carcass disposal. So on this slide, you can see a bird showing some of the signs that we mentioned earlier. You realize that the combs and then the waters are a bit bluish. Okay, can see coughing written there, and then there are nasal discharges. In the severe cases, it can even have blood in it. It will be a form of bloody discharge. And then there's swelling around the eyes or the infraorbital sinuses. There's lethargy, and then sudden death. You go into the farm, the birds were feeling okay, and then all of a sudden you have mortality 10, 20, 30%. There's purple discoloration of the shanks, the feet. And then in severe cases, you can get greenish stools or greenish diarrhea. Now, just a quick summary on everything we've done today. We've learned that avian influenza, commonly known as bird flu, is a viral infection that affects poultry. It is usually in wild birds who serve as carriers. Okay, we can have two main forms of this infection. We have the highly pathogenic and then the low pathogenic. The high pathogenic usually results from into sudden death and then high mortalities. But in the low pathogenic, you get a lot of sneezing, respiratory signs, coughing, some of those things. And then how to identify the low pathogenic. There will be swelling around the eyes, the infraorbital sinuses. There will be discharges from the nose and then the eyes. The animal will be coughing, there will be sneezing. In laying bears, there will be drop in egg production. Okay. And then in the high pathogenic, the blue discoloration of the combs battles. So you realize that head turns a bit bluish. You get blood, visceral organs. Once you open the carcass, you see a lot of hemorrhages, particular hemorrhages on visceral organs. And in severe cases, you get just as we saw in Newcastle also. Just behind the thighs, once you peel off the skin, you realize that there are a lot of blood in there, particular hemorrhages, ecchymotic hemorrhages in there. Okay. And then we are saying that with regards to treatment, you can't treat the viruses. No. The best you can do is to provide supportive care and then give antimicrobials for the possible secondary bacterial infection that may occur, because once the viruses gets in there or the pathogens get into the animal, it brings the immune system of the animals, and then other pathogens can come in and then cause infection. You can't vaccinate against it because the strains are a lot and it's very difficult to come up with commercial vaccines for you to use. That's how come even you don't have it on the national approved vaccination schedule, because it doesn't really make sense to bring a vaccine that might not even, we might not even have the strain in Ghana here. So your go-to way of prevention and control is through biosecurity. Restrict access of people to your farm, restrict access of wild birds onto your farm, proper hygiene, sanitation, and then surveillance. And then once the infection begins to go out of hand, we have to stamp out your birds. We will come in there, VSD will come in there, we will slaughter and kill all your birds, and then we'll tell you to wait for some time before you can do it again, because the virus takes a long time on in the environment. So please try not to get the infection at all in the first place. Focus on your biosecurity, and you will be able to prevent the infection from coming onto your farm. So I'll end it here, and then if there are any questions, you can go ahead and ask. I'm sorry for the network issue. I don't know what happened. So the floor is open for any questions. Thank you.
Okay, Doc, thank you very much. So even before uh, like our participants bring out their questions, I would want to ask a question. I think one time uh, I opened one egg, and I saw some blood stains in it. So whilst you were talking, it crossed my mind that, like, is it because the bird that laid the egg was having or was suffering from bird flu or avian influenza?
Okay, so I will say no. Okay,
Okay.
because beyond just avian influenza, some other bacterial infections can also present that way. Okay, especially
Okay.
in osteoporosis, for instance. You get a lot of these particular hemorrhages. So we look out for the gross signs. At the lab, we will do tests to confirm, okay? But these are
Okay.
just some of the signs to help you, the farmer, to sort of alert you so that you can easily consult your vet before the situation goes out of hand. So just as I'm
Okay.
stating, with this one, you get a lot of these hemorrhages on all the visceral organs. So you get it on the heart, not just on the egg follicles. So you get it on the heart,
Okay.
on the liver, the lungs, the egg follicles, on the intestines, and then one of the most common one that we use is once you peel off the skin around the thigh, you will get some blood in there. Okay, so even without even me doing the lab test, once I see some of these things, it draws my attention to it that okay, then let me just focus on doing the lab test to confirm if it is avian influenza, because there are a lot of tests that we have to run at the lab, but this one helps us to narrow in on the kind of test we have to do. So back to your question, it is not just avian influenza that will give you that, but in avian influenza, you get a lot of these blood hemorrhages on almost all the internal organs, and then specifically in the thigh area.
Okay. 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 Doc, thank you. So, and someone is asking, okay, so if you want to join in, I've put the link on the comment section. If you want to join in and ask your question, uh, you can do that. But if you want to type it too, you can just type it in the comment section. Those on YouTube and also on Facebook. So someone is asking, Emmanuel Tete Wayo is asking, in case of stamping, like dog, whilst you were presenting, you said you can come in onto someone's farm and kill all the animals. I mean the authorities, not you, but the authorities. So in case of the stamping out, would there be a compensation to restart the farm?
All right, so thank you for that. Yes, there's supposed to be compensation. However, there are criteria that you should meet. Okay, so first of
Okay,
all, your farm should be registered. You don't just come
okay,
and say, we came to slaughter or stamp out your animal, so you are coming for compensation, but your farm is not registered. Because if your farm is not registered, even though the physical farm is there that we all see, we need records at our end to confirm that indeed. And then secondly, proper records keeping. Even if your farm is registered and then you don't keep your records, who are we to say that um you just come and tell us, oh, you had 10,000 bears, but you don't have records showing that you have 10,000 bears. So we can't really compensate you for 10,000 bears based on the word of mouth. So you need to keep proper records. This will help you in your case to be duly compensated. And I know that one thing that Mr. Da Costa is very passionate about is records keeping. So please, I know he has given you some charts and then things like that. It's very important. It allows you to track everything you are doing on the farm, and then it makes your case easier when you are supposed to go in for your compensation. But make sure that your farm is at least registered and you have
okay,
proper records to show evidence of the things you are doing on the farm.
okay. So with the registration, then we mean the registration with the uh, Registrar General of Companies, right, Doc?
Yes, yeah,
Okay, and also with veterinary service.
exactly.
Or
Yes,
okay,
yes,
so it means you need two kind of registrations. You
yes, at
register your
least
business,
ESD
yeah, like
and then Registrar General.
Registrar General. Okay, and
Yes,
also you have to also keep records. Hmm. You have to also keep records, and if the record shows that your best are 100 and you go there to tell them your best are 1,000, I think there wouldn't be any kind of compensation for 1,000 best. Okay,
exactly.
okay. So If you have any question, kindly, if you want to type it, fine. But if you want to also join in, you can join in, and we'll we have just about 5 minutes to finish this particular. Someone is asking, what causes a bird to start limping and limping suddenly? Doc, kindly
Mm.
help me.
Um. So
Take,
there can be a lot of things that can
yeah.
result in maybe physical trauma. The leg got
Uh,
stuck somewhere. Something hit it. Yes,
Maybe a
but
walk crack. Oh, you the farmer
that's
also
it.
stepped on the leg and
Yes, yes.
it started limping. So
So
no,
that's
a
why
lot
it's
of
a bit
things.
too broad. A lot of things
Yeah,
can do
yeah.
that.
Okay, okay. So let me also check on the WhatsApp page if there's any question on the page. Okay, no question. So since there are no more questions, we will we will wrap up and give way for. Okay, so no question again. So before we leave of you, take leave of you, we have this beginner training. See, all that we've been doing, these are not beginner friendly. Because when you are starting, you don't even know the kind of diseases that can affect your breast. Okay, so this is what beginners normally need. So we are having a beginner training from 25th to 29th. So if perhaps you are watching us and you want to join in with the beginner friendly training, you can contact me. See, there's numbers on the flyer. The numbers on the flyer. You can contact any of the number, and we will add you to the upcoming training. And this one will show you how to brood your birds during construction stage, what you need to do. We'll talk about biosecurity. We'll talk about a lot of things that you need in order to start the farming. Okay, so thank Doc. Someone is asking, says that there are two types of bird flu, low or high. Which one is the compensation paid on?
Okay, so we just come to test for avian influenza. So usually
Okay,
in the high one, that's where you get a lot of the mortalities. Okay, usually in the
okay,
low, you might not get the mortalities, and then we might we might allow you to keep the birds. But usually in the high, that's when even the birds already are dying already, and then we will come in to help them die, and then get them all away. Okay, but it's paid on avian influenza in general. So if you come
okay,
then there's a need for us to stamp out your best. We do that, and then the compensation will be duly paid for.
okay, okay. So those that are saying, can we please share the slides and all that? See, this particular uh all our lessons are recorded and they are on the YouTube page. So you can download, or you can even put it on your phone forever. Okay, so you don't really need slides. You need the video, the explanation, and that's what Doc has done. So this is on YouTube. You can download it, and it will be on your phone forever and ever. I think the slides there, you don't really need it. You need the explanation, and that's what Doc has already done. Okay, okay. So I will thank all of us for coming, and also Doc, we thank you very much. Like every time you call on you, you help us. So since we've now ended uh, the viral diseases, then the next time we will meet, which other area will we be looking at?
Maybe we can go into the. We will start some bacterial infections. We just go into
Okay,
a few of the common ones, and then we'll see how that one also progresses.
okay, okay, okay. Thank you, Doc, and thank you. God bless you. So, uh, any if any information comes from Doc, we will put it in the groups that we are all in, and we'll let you know the next lesson and the date for the next lesson. Okay. So, Doc, thank you. I think we will end our stream.
All right, all right.
So, okay. Thank you.
Sure. You're welcome. Have a nice evening.
You too, Doc.
All
Okay.
right.
Bye bye to
Bye
everyone.
bye. Good night to everyone.
Okay.